Welcome to the Orange County Older Adults Needs Assessment presentation. During this presentation, you will hear about the key findings of the Older Adults Needs Assessment, which is the first phase in the development of Orange County's Master Plan for Aging. During today's presentation, we will be presenting on the Older Adults Needs Assessment, overall process, the methodology and demographics of the survey, the community survey overview, which includes data, demographic findings, key findings, themes and trends, design of the report and where you can obtain additional information or access the full report, the Orange County Master Plan for Aging considerations based on the findings and what we're hearing from stakeholders involved in the process, next steps in the development of the Master Plan for Aging, and we will do a quick overview of some frequently asked questions from our stakeholders. Let's start with a little bit of background on how did Orange County get here. In June of 2019, California's Governor Newsom signed an executive order calling for the development of the California Master Plan for Aging to serve as a blueprint for local governments and communities to build a California for all ages by 2030. This was an effort to prepare the state for the anticipated growth of older adults aged 60 and older by the year 2030 and for future years. In January of 2021, California released its first Master Plan for Aging to serve as that roadmap, outlining 5 bold goals, in which you will hear more about these goals further along in the presentation. Locally, our Orange County began the planning phase for the development of our Master Plan for Aging. This process began with the administration of the Community Needs Assessment was conducted from September of 2023 through January of 2024. Immediately starting the validation of the data, the analysis to be able to put a full report for public awareness. In February of 2025, Orange County released the Older Adults Needs Assessment report, which brings us here today to this presentation so that you can learn what our community is saying about their needs in Orange County.
The Older Adults Needs Assessment was designed to align with California's 5 bold goals and 23 strategies, meaning the questions were developed to assess how Orange County is doing from the community perspective. Within California's Goal 4, Caregiving That Works, there were additional 2 surveys developed to explore the caretaker perspective. The caregiver survey was distributed to those unpaid family and friends who help older adult residents within Orange County, as well as the paid provider survey to assess those who provide care through a paid means, such as in-home nurses or a resource provider. The survey was available by paper, online, or over the phone, and in multiple languages. Overall, for all 3 surveys, there were 7,522 valid responses, which meant that the responses met the criteria for participating in the survey. Using the criteria for valid responses for survey data of 100 to 1,000 participants, all 3 surveys yielded enough participants to present credible findings and insight. Within the community survey, there were large enough samples within subgroups to also include additional findings. The data collection was based on a convenience-targeted sampling method, which means locations and groups that cater to older adults were approached to help fill out and distribute the survey information. This also means that the results are specific to those who chose to voluntarily answer and may not be generalizable to all Orange County adults. In addition, there may be a different number of responses based on each question because the survey was voluntary, whereas participants were able to choose to answer a question or not. It is important to consider the demographics of the survey participants for the overall findings within the report, as the demographics provide insight to who responded. For the Orange County Community Survey, there were a total of 5,657 valid responses. It is important to note that efforts were made to include hard-to-reach populations that typically do not respond to general surveys as frequently, which included unhoused and incarcerated individuals. Participants within the sample were aged 55 and older, although those 60 and older were compared to Orange County residents using the U.S. Census estimates for 2023. As included in the graph, the survey participants identified closely with most age groups, whereas there was a slightly lower response representation from those in the 60 to 64 age group. The average age of participants identified as 70 years old. For those who volunteered to include their education, almost half of the survey participants identified as having a bachelor's degree or higher. This was higher than the overall Orange County population within this age group. In addition, when considering veteran status, this category closely reflected the veteran population and was slightly higher, with 8% of participants identifying as a veteran. When assessing household income, the highest category with participants identifying was less than $25,000. This was 12 percentage points more than the overall Orange County population, indicating sample of potentially lower income than Orange County older adults aged 60 or older. Within other income categories, there was a good spread of responses with at least 10% or more of the participants. For race and ethnicity, participants were asked to identify both race and ethnicity in the same question within the survey. Therefore, percentages do not add up to 100%. Overall, there were fewer participants who identified as white, two or more races, or some other race than the overall Orange County population. The Orange County Older Adults Community Survey included a Middle Eastern, North American MENA category, which is not included in the U.S. Census for comparisons. Additional information related to self-identified Asian and Hispanic Latino category details are provided in the appendix of the report on page 53. Most participants identified as female, and there were 4.3% who preferred not to answer or did not select a category, and very few, 0.3%, selected one of the following categories: transgender female, agender do not identify, and gender non-conforming. The survey asked participants their current living situations. Although this category is not included in the census, a majority of the participants who disclose this information, or 58.5%, own their own home or condo, followed by 21.2% selecting renting their home or apartment. There were participants responding in all of the categories, including over 1% in the correctional institution and unhoused categories, which correlates to the outreach efforts. For the city of residence, there were respondents within all cities. The highest responses for the survey were from Anaheim, Santa Ana, and Irvine. This correlated to the top cities in which Orange County older adult residents live, except for Huntington Beach. As this survey was voluntary, only 77% of respondents chose to disclose their city of residence, so it is possible the cities with lower numbers have higher representation in the findings. One of the main questions used throughout all of the goals on the survey was a multiple choice with a list of 31 concerns. The goals are shown on the bottom left corner as shown in this graph. Most items were part of Goal 2, Health Reimagined. Participants were asked what their top 3 concerns were. Of those who selected 3, the responses per item ranged from 38% to 0%. Ranges were created based on these percentages for high, medium, and low. There was only one item that met the criteria for a high percentage, which was Alzheimer's disease. Most of the concerns in the medium range were health and behavioral health related, with the exception of finances. All of their categories fell in the low range, with sexual health, losing respect from others, substance abuse, and tobacco use having the lowest endorsement. All of the concern ratings are listed in the report with in the beginning section of the goals with additional subgroup information. Within the report, subgroups with 100 participant responses, which were above the overall percentages, are listed, and within the website, all subgroups with 100 participant responses over and under the overall percentage are included. The second main finding within the survey were based on 11 different community ratings, which included topics within each of the goals except for Goal 4, Caregiving That Works. Participants were asked how they felt about each of these items based on their city of residence. Responses of excellent and good were included in the percentages presented in this graph. Responses ranged from 21% to 63%, and ranges were created similar to those with the concern ratings for high, medium, and low. Overall, opportunities for community involvement and community as a place to retire were highly rated, suggesting that older adults feel Orange County is an ideal place to retire and lends itself to social activities. The lowest scoring items were availability of long-term options and availability of daytime care options, suggesting Orange County does not have as many options for when older adults may need more assistance. All city ratings are listed in the report within the beginning section of the goals with additional city information. Although not all participants volunteered to provide their city of residence, cities' percentages with 100 participant responses or more are included in both the report as well as in the website. California's Goal 1, Housing for All Ages and Stages, focuses on community planning and infrastructure of neighborhoods, which includes housing for older adults designed to accommodate different household sizes, accessible transportation options, welcoming parks and public spaces, and strong climate and disaster readiness. Community survey findings specifically related to this goal revealed improvement can be made in accessible housing, daytime care options, and long-term care options as shown on the previous slide. In addition, older adults rated the top 2 most important services for older adults to be transportation services and in-home care options. California's Goal 2, Health Reimagined, addresses planning for chronic illnesses, gaps in home or community care, and creation of healthy communities for residents across their lifespan, and ameliorating systematic racism as evidenced through disproportionate death rates. Community survey key findings specifically related to this goal revealed health-related issues as the top concern for older adults within Orange County, with the top 5 being health-related as shown in the previous slide. Most of the residents within Orange County were insured, although the top barriers for assessing healthcare were appointments not available at convenient times, participants felt their copays were too high in cost, participants did not know where to get help, and participants did not always have transportation to take them to appointments. California's Goal 3, Inclusion and Equity, Not Isolation, focuses on continuing, evolving, and creating new opportunities for meaningful engagement for all older adult age groups. This goal also includes prevention of elder abuse, digital technologies, employment, and volunteer opportunities. Community survey key findings specifically related to this goal revealed there can be an improvement in the quality and variety of employment opportunities within Orange County cities. Approximately 1 in 2 reported isolation and loneliness to be a contribution to medical issues. 1 in 2 experienced age-based discrimination. 1 in 4 reported politics contributed to their behavioral health issues. And 1 in 4 were not comfortable with technology or using the internet. This also was more prevalently endorsed in the higher age groups, especially those 80 years and above. Goal 4, Caregiving That Works, focuses on ensuring support is provided for caregivers, which include those who are paid, as well as family and friends. Within the community survey, 1 in 3 participants reported caring for someone else 55 years and older within the past year. These rates increased to about half based on higher income. Overall, many of the participants within the sample care for others, and potentially the ability to be a caregiver is determined by income more so than other aspects. As mentioned previously, the caregiver survey had 935 participants who identified themselves as unpaid family or friends, 18 years or older, that cared for an adult who resided in Orange County. Most of those who cared for others identified with the 50 to 64-year-old age group, which correlated to the findings within the community survey. Most, 78% of caregivers were female, and about half self-identified as white. Within the sample, the average time caregivers had provided care was 7 years, and the average age for the older adult cared for was 79 years old. The caregiver survey revealed that caregiving could be emotionally, physically, and/or financially challenging, resulting in negative impacts on their social lives and increases feelings of isolation or depression. Their areas of greatest concern were related to lack of sufficient time for the responsibilities or themselves knowing about resources that were available to them. Given their time restraints, it was not surprising that caregivers prefer online support. Despite the toll reported by caregivers reported doing the work because it was rewarding by being able to spend time with the person they cared for, and oftentimes they were able to assist them to be able to stay within their homes. Potential areas for improvement are ensuring information and resources are available to caregivers and providing online support options to caregivers. The paid provider survey was also available to those who are in paid positions and service older adults within Orange County. As mentioned previously, there were a total of 935 valid responses. Most of the respondents within the sample, about half, identified as an in-home nursing care or supportive services employee, and the second highest category was about 1 in 4 identifying as a caregiving resource provider. According to the paid provider responses, the top health or social concern amongst the clients they serve are Alzheimer's disease or dementia, caregiving, mental health, and disabilities. These findings are consistent with the community survey respondents' highest concern, Alzheimer's disease. Although more than half of paid providers indicated it was moderately easy to access services, there was still a notable amount of providers, about 1 in 5, who indicated it was not easy at all. This indicates there can be some areas of improvement. Slightly over 1 in 2 felt services are available but insufficient to meet the needs of the population, suggesting there can be improvements made within the capacity of services. The average rating for ease of keeping up with services was 5.3 out of 10. Overall, potential areas for improvement are closing any service gaps and increasing the capacity with education and promotion of existing resources rather than building new infrastructure of services and support. Goal 5, Affordable Aging, focuses on economic security, which is essential to living and aging well. This goal recognizes the financial changes individuals may encounter when they can no longer rely on past income, which may have consisted of individual savings, employer-paid pensions, and Social Security. Within the community survey, about 3 in 20 reported cost of living and economic instability contributes to their medical and/or behavioral health issues. Financial insecurity and becoming homeless was relatively low concern for the overall sample, and most concerning with non-homeowners and those 55 to 64 years old. As the Orange County population continues to age, there may be fewer homeowners within the older adult population, and a higher percentage of those having to live in rentals, less stable housing settings, or care facilities. For more details of differences within these participants, please refer to page 48 within the report. Overall themes and trends were assessed to determine commonalities within the responses on the survey and among responses within more than one of the surveys. Alzheimer's disease, dementia, and memory loss were consistently a top concern among health and also behavioral health issues. Cost of living, financial stress were oftentimes associated to both behavioral health and medical issues within the sample. The top barriers for seeking both mental and medical care were lack of information about where to get help, appointments not available at convenient times, and high cost of services and copays. Continuing the overall themes and trends, for those within 55 to 64 years old, there were higher concerns around becoming homeless, financial means, and lack of health insurance. It is also important to note that although internet and technology may make services and providing information easier, not all participants were interested in the internet and technology. This was especially the case as individuals age, and the highest within ages 80 years and above. Overall, within Orange County, a high amount, just over about 53%, reported being discriminated against, whereas most reported being discriminated based on age, which increased at 70 years and above, followed by being discriminated against based on race or ethnicity at 36%, and 23% of the respondents reported based on language. This suggests that Orange County can improve in aspects of how older adults are treated within their communities. There are a lot of details within the report for not only the findings highlighted in the presentation, but also other questions and item responses within the survey aligned to the 5 bold goals. The report includes the following sections: executive summary, overarching themes and trends, introduction, methodology and limitations, community survey demographics, concerns and community ratings, Orange County items related to California strategies, considerations for the Orange County Master Plan for Aging, and next steps. Most of the sections I have highlighted today. The 2 bolded categories on the slide have additional information that may be of interest if the community is looking for specific findings. The concerns and community ratings pages are within the beginning of each goal and provide the additional details for subgroup information as mentioned earlier. Subgroups for concerns include those with 100 responses or more for age, gender, race, ethnicity, education, and household income. Community ratings provide the range of the highest to lowest for all cities, regardless of the city number, and also note those self-identified cities with 100 respondents or more for highest and lowest ratings. All cities with 100 or more participants identifying their city are provided in the appendix of the report. The Orange County items related to California strategies pages include additional details for survey questions related to the 23 California strategies within the 5 bold goals. On the sample page to the left, the additional detail includes a map showing all cities' range of responses, as well as other inclusion and equity and aging responses, such as the percent of participants who felt the items contributed to their medical and/or behavioral health issues. The sample page for Goal 4 on the right shows additional information for those who reported not being comfortable with the internet and additional details for those who reported caregiving for someone 55 years or older within the past 12 months. The website, which houses the report as well as sections of the report with more interactive capabilities, is located in the Orange County Office on Aging website. Within this webpage, there is a tab on the top labeled Master Plan for Aging that will lead to the assessment homepage. When selecting the Master Plan for Aging tab, it will take you to the homepage as shown on the top left. Upon scrolling down, there are interactive buttons with the first labeled Orange County Older Adults Needs Assessment Report PDF. When clicking on this button, it will open the full report PDF. The subsequent buttons will take you to specific sections within the report. If you scroll down further, the Orange County survey results within each of the California's 5 goals will show. When you click on these, more information within the goal will be displayed starting with the goal details and key findings. If you scroll down further, the community ratings will be displayed. When selecting the percentages for cities with 100 or more participant responses, the graph will open. This graph will show all cities, highest to lowest, with the overall percentage for the item as a blue line. The button on the top will allow you to change the figure to the table. The table has capabilities to alphabetize the cities as shown, or when you click on the percentage arrow, the cities can be ordered from highest to lowest or lowest to highest. The website also has all of the concern ratings and subgroups. When selecting the subgroups with 100 or more participants will be displayed in a graph showing reported household income. The average line for all responses is included in each of the graphs. As we can see here in the example, income has a role in emergency preparedness being a concern for participants. We hope that these resources can assist not only the county, but also the community and partner agencies in understanding the insight, opinions, and perspectives within this large sample of community members to help support efforts and services for older adults. I will now turn it over for more on how the County of Orange will be incorporating some of these findings in the Master Plan for Aging.
Orange County is thankful to all stakeholders and the voices reflected in this report. Thank you to all community partners that supported and assisted in coordinating the administration of the surveys. Your efforts and support are valued. The strategy considerations are intended to help identify and address areas of focus with the understanding that they may be refined and adjusted subject to ongoing review based on emerging trends, on aging both at local and state levels, community input, and the county's capacity. The voices reflected in this report expressed that the role of county government is to be a facilitator, direct resources and services. This is a confirmation that the county alone cannot provide a safety net for covering the needs of our older adults, and therefore prioritizes the importance of community partnerships. This flexible approach ensures that our county remains responsive to the evolving needs of our aging population. For Goal 1, Housing for All Ages and Stages. To better support older adults to age in place, identifying and supporting programs, services, and initiatives that focus on availability of accessible housing and supportive services. These supportive services include areas like healthcare access, transportation, and social supports for social engagement. And although emergency preparedness was a relatively low concern, we cannot ignore the importance of disaster planning as we continue to learn from recent lived experiences and cannot control future natural disasters from happening. For Goal 2, Health Reimagined. Takeaways for this goal are prioritizing strategies that support the prevention of physical and mental and/or cognitive health issues, accessibility and navigation of health-related information and resources has risen to the top. A focus on strengthening partnerships with our health plans and our care systems, expanding the awareness efforts on disease prevention, learning how to manage chronic disease, mental health, and of course, at the very top is the awareness and information on Alzheimer's and dementia care. Goal 3 is about inclusion and equity, not isolation. And we're learning considerations in this goal is to foster inclusion and equity for older adults, efforts focusing on strengthening and/or expanding support systems that foster an age-friendly and culturally inclusive social engagement, workplace inclusion for a safe and meaningful work experience for our older adults. Transportation is embedded under this goal as it is an important need that interrelates all aspects of engagements for our older adults. Goal 4 is about caregiving that works. Our strategy and takeaways considerations for this goal is twofold. One, from the perspective of the care recipient, their focus and areas of importance really point to the importance of accessing in-home care assistance. However, from the perspective of the care provider, accessing support via other methods such as online or virtual options rises to their top needs as caregivers try to manage and balance between their caregiving responsibilities and their own self-care. Both perspectives, however, expressing the importance of the services being culturally inclusive. And finally, we get to Goal 5, affordable aging. Older adults relying on limited income or living well below the federal poverty limits are most likely to be concerned with making ends meet, having access to affordable and nutritious food, and the fear of experiencing homelessness in their older years. The strategy's considerations are to prioritize and leverage partnerships that support integration of affordable housing with supportive services needed to maximize options for living and aging in place. Strengthening those linkages for additional critical resources such as food assistance and legal services to help enhance the financial safety net for our older adults. And just as important, ensuring collaboration with community partners to develop financial support services tailored more specifically to the needs of older adults. Now that we have concluded the findings within our older adults needs assessment report, what are those next steps within our county towards the development of our local master plan for aging? Next steps, which currently we are finalizing, what are those considerations, our county service capacities, our stakeholders' input and their comments related to the strategies and focus areas. In this month of April, we are currently finalizing the priorities and what those focus areas will be into the next year and potentially future years. We are targeting that between now and potentially end of May, we will continue to receive our stakeholder comments and any feedback in this development. And ultimate goal to publicize the local Orange County's Master Plan for Aging is end of June of 2025. We are approaching the end of today's presentation. We'd like to continue to express the importance of your input and comments. You can do so by scanning the QR code on your screen, as well as visiting the link on this screen to submit questions and comments. You can also submit questions and comments via our email at ocmasterplanforaging@ocgov.com. Again, that's ocmasterplanforaging@ocgov.com. Additionally, you can visit the Office on Aging website at officeonaging.ocgov.com/master-plan-aging, where you will find access to the full older adults needs assessment report and some demographics and data components. The following slides provide responses to some of the frequently asked questions that have been submitted by our community stakeholders. You may take your time and peruse through the next few slides to look at the questions, but they are also available on the Master Plan for Aging's website, located at officeonaging.ocgov.com/master-plan-aging. This concludes our presentation. Thank you for joining us.